The repair of facial and body injuries, known as plastic surgery, dates back more than 4,000 years and can trace its lineage throughout the Egyptian, Greek, Indian, and Roman empires up to the present. In fact, the word plastic is a derivative of the ancient Greek word plastikos, meaning to mold or shape. And so, contrary to common belief, plastic surgery is not at all related to credit cards or modern-day synthetic polymer materials. The history of plastic surgery and its relative newcomer offshoot, cosmetic surgery, is fascinating indeed. Over the centuries, the field has undergone a great deal of evolutionary changes and modifications. As it started from removing slave brandings and mending war wounds, then moved on to altering birth deformities and repairing misshapen earlobes, and ultimately to transforming the body to match shifting ideals of beauty based on the era. Many of the actual techniques and methods currently used in plastic surgery are little different than those practiced thousands of years ago, and some of the newest techniques and instruments used by plastic and cosmetic surgeons involve lasers and laser-assisted procedures, along with devices that, a few decades ago, would have been mistaken for an alien ray gun from another planet in a sci-fi movie. Plastic surgery's breakthroughs and what is on the horizon today might also sound like the stuff of science fiction as told by those experts who perform these astonishing, technologically advanced transformations in this rapidly progressing field. The desire to maintain, restore, or enhance human appearance seems to be almost as old as humankind itself. In ancient Egypt, papyrus texts depict exfoliation, skin rejuvenation, and treatments to prevent or reverse male pattern baldness. In ancient India, China, Persia, Greece, Rome, and even later on in medieval Europe, documented evidence exists detailing techniques and procedures that were clearly intended to alter or repair one's physical appearance.
The earliest efforts of plastic surgery actually date way back to ancient Greek, ancient Indian times, and for the most part involved reconstructive surgery, somebody that was deformed or had an injury or a problem. Most of the work, surgery was a very invasive process. We didn't really have anesthesia, so if you were going to expose someone to that, you were for the most part looking to rebuild something that was a significant deformity.
Plastic surgery operations were documented briefly in early Roman times, with physicians performing simple otoplasty procedures, otherwise known as the repairing of damaged ears of soldiers wounded in battle. Ancient surgeons wrote texts of instruction for students to learn from, many chapters devoted to healing and repair of gaping, disfiguring wounds to restore the appearance of soldiers returning from war.
There's quite a bit of stuff in the ancient literature that discusses early injuries, nasal reconstruction, some work on ears, maybe an attempt at moving some flaps or some tissue into different areas. Very rudimentary. You have to remember that surgery was very rudimentary.
Some of the first highly detailed written medical accounts of reconstructive surgery go back as far as 3,000 years ago to ancient India. During this period, Indian surgeons had lots of opportunities to hone their skills of nose repair, since the Indian penal system at that time decreed nose amputation as the punishment for adultery.
In ancient India, as early as 800 BC, surgeons were using skin grafts to repair the ear, the nose, and the lips. The Gangra district in India was famous in the ancient world for its plastic surgeons. Some scholars are even of the opinion that the word for the region itself, Gangara, is from Gan, which means ear, plus Garha, which means repair.
Through the use of what was called a pedicle cheek flap, these surgeons pioneered what was to become the modern nose jobs, or rhinoplasty, which, with its later use of tissue from the forehead, was dubbed the Indian technique.
The Charaka Samhita and Sushruta Samhita are amongst the oldest known texts from ancient Indian medicine known as Ayurveda, the Indian science of medicine. These texts deal with medicine and healing, contain quite a few passages on plastic surgery. These original manuscripts were based on a series of lectures between the physician considered to be the father of modern Indian medicine and his students and disciples.
From those ancient times to the present day in India and elsewhere throughout the world, the actual procedures used back then are strikingly similar to those used today. In addition, there's a long tradition of highly educated, publicly revered plastic surgeons and well-regarded plastic surgery operations of the nose, ear, and lip that plastic surgeons of today still follow and study.
The ancient Indian medicine and the techniques developed in early 800 BC India, such as surgical techniques for skin grafting, are relevant today in my practice. In fact, when a patient, for example, comes to me for a complication related to eyelid surgery done somewhere else, I actually use skin grafting techniques which were based on that foundation to reconstruct the skin that was lost from eyelid surgery.
In dealing with the history of plastic surgery, that's the part that we learn from day one in studying as a resident, because the foundation, the base of our training is from the history, from way back in written texts from 600 BC with the first nasal reconstructions, to all the way till the modern generation.
Nasal reconstruction, nose injuries were relatively common. In fact, they were in many cultures. The amputation of the nose was considered a penalty for thievery or being a prisoner of war or whatever. And there were a group of Sicilian surgeons in the very early 1500s that reconstructed noses. And then Gaspar Tagliacozzi, I think, refined those techniques and wrote about them. So we're going back to at least the 1500s.
During medieval times, a much greater knowledge of anatomy and reconstructive surgical procedures were developed at an accelerated pace as dissections were allowed. Doctors would, as part of their training, be lectured on the theories of Galen, and often a dissection would form part of the teaching. Surgery was mostly limited to the removal of cysts, cataracts, and minor operations to repair wounds, procedures which developed as a result of conflicts, battles large and small.
How are you? Well, I think if you look at plastic surgery, which has existed since probably 2,000 years before the birth of Christ, the most significant, if you will, modern-day plastic surgeon was Gaspar Tagliacozzi, who was a professor of anatomy at the University of Bologna and practiced reconstructive surgery around 1550 to probably 1593, and wrote the first textbook that described in detail how to do reconstructive surgery of cleft lips, noses, all varieties of deformities.
At the hands of Dr. Tagliacozzi, plastic surgery had attained fame in Europe. Tagliacozzi's book, De Corturum Chirurgia per Incisionem, the English translation being The Surgery of Defects by Implantation, printed in 1597, was the first scientific composition on plastic surgery. Dr. Tagliacozzi vividly described his methods of substitution of the nose by skin from the arm and of replacement of the ears and lips, demonstrating his work throughout the manuscript by way of a large number of illustrations. However, in that society at that time, many powerful church officials felt that if someone was born with a cleft lip, then there was a reason for that, and it was God's reason. Therefore, if a doctor was going to intervene and fix that deformity, then that surgeon was really altering God's work and God's intent. Therefore, the church's official position was that plastic surgery was blasphemy, and there were surgeons who were actually and literally burned at the stake as a consequence. Tagliacozzi was buried on the university grounds of Bologna. However, shortly after Tagliacozzi's death, the church excommunicated him in disgrace, and an inquisitional tribunal subsequently had his remains dug up and then replaced into an unconsecrated grave as a penalty for what he had done. The noted writer Voltaire even wrote a satirical poem on Tagliacozzi and his operation on the nose, remarking how he used flaps from the buttocks. Just as how plastic surgery started with reconstructing facial features of ancient Greek and Roman warriors wounded in battle, warfare through the ages has always been a driving force to develop new techniques to handle new and ever more horrible soldiers' wounds. Doctors did recognize that infection, massive blood loss, and pain were often the primary causes of poor outcomes and even death during or as a result of the surgical procedure. To contend with this, physicians started with using spirits or wine as an antiseptic and anesthetic, along with drugs to ease pain. By the end of the 18th century, interest in reconstructive surgery enjoyed yet another revival, leading to further great advances in the 19th century. Perhaps the single most important impetus behind this was a letter by a British surgeon describing the reconstruction of a man's nose by a member of the brickmaker caste in India. The surgery was witnessed by two British surgeons, and popular opinion in England followed the line of thought that if an Indian tile layer or brickmaker could perform such a procedure, then certainly British surgeons would be able to improve upon that success. The progress of the 19th century made possible a broader understanding of anesthesia and the different bodily systems. This understanding allowed surgeons to perform a wider variety of procedures of increasing complexity: cleft lip repair, true skin grafts, and the first recorded instances of modern aesthetic nose reconstruction, and even breast augmentation. America's first plastic surgeon was Dr. John Peter Mettauer, born in Virginia in 1787, who in 1827 performed the first cleft palate surgery on record with instruments he himself designed. As in ancient Egypt and India, it was war that presented the opportunity for surgeons to perfect their techniques during the American Civil War, as they strove to repair the bodies of injured soldiers. Due to the many dangers of surgery in those times, cosmetic surgery was rarely performed until around the 1900s in the United States. Advancements continued into the 20th century. While many advances were made throughout the ages, further perfecting and adding to the specialty, medical historians generally consider the modern specialty of plastic surgery to have emerged during the First World War. As sophisticated weaponry showered explosives onto millions of entrenched troops in Europe and the Middle East through the years 1914 to 1918, new and innovative reconstructive procedures were desperately needed.
With the 20th century and major wars, and really after the First World War, if you were to try to say, where did plastic surgery and cosmetics, well, plastic surgery, reconstructive surgery really start, it would have really been after World War I. And it was a direct offshoot of massive injuries. And a lot of it had to do with our oral maxillofacial colleagues, as well as our dental colleagues, trying to reconstruct the mouth, the oral cavity, as well as facial reconstruction. The earliest in the 20s and the 30s, most of the time that was what that involved.
Aside from the potentially life-threatening implications of the horrifying skull wounds, jaw fractures, and facial burns suffered by the men of combat units, even once stabilized, many found that their troubles were only beginning. As they returned home, discharged soldiers with gross facial deformity found it impossible to acquire a job, find a wife, or simply walk down the street without receiving glances of disgust. It was clear to the pioneers of modern plastic surgery that something needed to be done.
Then there was a greater evolution and an expansion, and it also collated with development of anesthetics, local anesthesia, ability to sedate somebody, different medications, awareness of antibiotics, all kinds of things like that led up to probably World War II. Initially in the early years, if you go back to where surgery started as formal specialties, it actually started at Johns Hopkins Hospital. The first board was the American Board of Otolaryngology and Ophthalmology. That was really where it started. And then other specialties evolved, neurosurgery, general surgery, and there were different divisions. And then there's, as in all things, there's an evolution. As we went through World War II, there were then certain general surgeons that were very interested in doing reconstructive work after World War II, really developed, sort of laid the groundwork for the modern development of plastic surgery.
In response to war-caused deformities in the Vietnam War, American surgeons developed the most advanced plastic surgery techniques in the world. The history of plastic surgery in America continued to evolve from then. And even now, repairing damages done to soldiers and civilians in times of war is an unfortunate way that the specialty progresses.
Fortunately or unfortunately, every great war brings advances in surgical technique and technology and saving lives and limbs. And there were things done during the Vietnam era that couldn't be done in the Korean War. It's quite remarkable, and these advances do translate into many areas of modern medicine, not just cosmetic plastic surgery, but in all allied areas that even are apart from trauma.
I had been to Vietnam, and I did have an interest in reconstructive surgery at that time, and so I went into plastic surgery at a very fortuitous time, because in the late 70s there was a true revolution in the thought process and in the approach and in the way plastic surgeons saw and solved problems. Burn surgery became more aggressive. Hand surgery became what it is now with early mobilization. And I think if there were a common denominator in all of this, cosmetic surgery included, which then became anatomically based. It was discovered by Tord Skog in Sweden that there was a deep layer just beneath the skin, that if that were tightened up, the result of a facelift was much more natural, much more long-lasting, and the results were vastly superior. That was recognized, and within 3-4 years spread throughout everywhere. And now I would say most surgeons use that deep layer to do cosmetic surgery. So there was this true revolution. The specialty, I'd say, in 1982 was nothing like what it was in 1972.
Each war brings a high number of shattered soldiers whose faces were rebuilt by new reconstructive surgical procedures. In the early days, the wonderment of these operations were publicized widely, reported in the press mainly as a way to restore hope amongst soldiers. Yet surgeons who see the capabilities of ever-improving reconstructive procedures begin to realize the possibilities for other aesthetic uses. Besides war-related injuries to soldiers, reconstructive surgery focuses on undoing or masking the destructive effects of trauma, birth defects, previous surgery or disease, such as the rebuilding of amputated or damaged arms or legs, repairing cleft palates or lips, badly formed noses and ears, and reconstructing a breast after mastectomy. Reconstructive surgery often includes moving tissue from other parts of the body to the affected area. The war in Iraq and Afghanistan has meant addressing the challenges facing the new battlefields and new technological advances in medical treatment in the field, ensuring the survival of soldiers who may have been injured in a roadside bomb attack and would have otherwise been killed in previous wars. Their survival, however, would require substantial, progressive, ongoing reconstructive surgeries. During this time, there has even been an explosion of prosthetic technology, evolving hand in hand with plastic surgical technology.
I remember everything that happened that day, and we had received some sniper fire, and we had taken casualties from sniper fire, so I decided to go on the dirt road due to the fact that on the hardball there was a lot of high rises, so they had a lot more cleaner shots for the Marines that we had picked up that were in open trucks. We passed about 50 meters and we hit an IED. The IED blew the vehicle upside down, killing my gunner and my commanding officer who was sitting right behind me. It hit the fuel cell of the vehicle, so there was a lot of diesel all over the place. I don't know how I got through there, but I got through there. And once I came out, some of the Marines that I talked to, they told me that I was engulfed in flames.
Unfortunately, by the nature of these IEDs and the nature of wounds as I understand them, there are amputations and there are intense burns because of the blast. There, for example, is an area where a tremendous amount of research is underway and has been relatively successful in being able to perhaps create a prosthetic arm and hand that picks up impulses from nerves and will function at some point as a real artificial hand and arm. The care of the burns is, I think, twofold. First, they go to Brooke Army Hospital, which is the best burn unit in the world, period. They do a better job at saving lives than any single center you can imagine. Once someone is recovered from the burn and they're skin grafted and whatever, then it's a whole different phase, and that's the reconstruction of what's damaged, the replacement of whatever is missing, making the face look better.
He reconstructed my nose, and we've come so far from not having one to having one, and it makes me blend in a lot more with you know, the people, the general population, and makes me feel better about myself, and knowing that my kids ain't gonna be angry and they ain't gonna come at me with a couple questions later on, and I have to explain to them why the people do what they do.
Along with a man by the name of Ron Katz, established Operation Mend, which is an outreach of the private sector to offer a reconstructive surgery to soldiers and Marines injured in the war. And this is a melding of military and private sector medicine. But it has been a very successful program, and in particular, I think it has been gratifying to the people at UCLA because there is this sense, as I said, of giving something back to those that have given a great deal to us.
Clearly, the devastation of war was the catalyst that propelled the field of plastic surgery on the path to its current global prominence. Today, whenever the world finds itself engulfed in yet another war, with the technology of the times once again producing unique injuries in mass quantities, history of war has proven to be indeed cyclical in nature, replaying itself on the various stages of the planet's war theaters. The science of medicine is always continuing to expand exponentially, too. As plastic surgery has evolved and developed, a byproduct, an offshoot of using those techniques for reconstructive purposes, has been applied to people who simply wanted to look better, creating the field of cosmetic surgery. Sometimes there is even an overlap to these two fields of surgery.
In the past, plastic surgery was considered a little bit alternative, a little bit secret by many people, and it has to do with just the nature of the field. There is a lot of science involved, but there's a component of art, a component of qualitative problem solving, and at times people considered plastic surgery just to be appearance oriented or unnecessary, elective. Plastic surgery is a mix of reconstructive and cosmetic surgery, and it's difficult at times to divide the two. For instance, a cleft lip is a birth deformity, and many people would consider that a reconstructive procedure, but a lot of it has to do with the cosmetic appearance, to fix a problem so that person can fit in society, can do well, so that meeting that person for the first 5 minutes you're not staring at the cleft lip, but you can actually interact with that person for who they are, and they can get their business done.
Once described only in hushed tones and known as a mainly Caucasian treatment reserved for the rich and famous, cosmetic surgery of the early days did not allow for the average person to benefit from the procedures that were secretly reshaping society's elite. In early decades of the last century, there was also a sense of shame in speaking openly about having cosmetic work performed. Additionally, there was also a more mainstream idea of beauty in cosmetic surgery's history in the decades from 1940 to 1980, when people would seek procedures in order to conform to the day's idea of beauty.
The stigma was associated for a long time with a few things. One was the sense of maybe you were being conceited or vain, and there's a difference. Vanity to me is someone who is almost dysfunctional, who is just looking in the mirror all day long and really obsessed about the external. Taking pride in your appearance is just natural. Everybody takes pride, wants to take pride in how they look. How you look dictates so much in how you feel. And transforming a person's life by improving their appearance really does have a transforming effect in so many ways on their confidence level and how they're seen by everyone else and how they see themselves.
All right, good. Hello, Stephanie.
Hi.
Hey, how you doing?
Good, how are you?
Good, great. This is Kathy.
Hi.
Well, the stigma of cosmetic surgery or plastic surgery really relates on two levels. One is people's perception of vanity. Very, very important premise, very important premise. As a head and neck cancer surgeon, I've taken care of about 1,265 tumor patients. I make a bigger difference in people's lives now than when I used to save their lives. Now, that's not because people are shallow or vain. It's because quality of life is such an important issue. I mean, it is crucial. Other people realized that earlier on, and they might have surgery, but it was not looked upon in a societal way very favorably. So it was considered excessively vain, somewhat frivolous. You were exposing yourself to risk.
As with other areas of science and medicine, cosmetic surgery discoveries were happening at a breakneck pace, often derived from innovations tested in the rear area hospitals of Korea. Internal wiring for facial fractures, rotation flaps for skin deformities, and a bevy of other new techniques were developed by plastic surgeons in the 1950s.
So the giants that came before me, they would write papers or just want to talk about facelifts or forehead lifts or rhinoplasty, and many times they were sanctioned. They weren't allowed to present their work. People wanted to present at our national meetings, at our annual meetings. They wanted to present the absolute hardcore. We're real doctors, we're real surgeons. We don't do frivolous things, we don't do casual things. So many of the giants, innovative people, they were relegated to set up their own societies, their own clubs, their own meetings. They weren't allowed to, their papers, their production, their work was not allowed to be presented to other surgeons. And a lot of times the teaching was not allowed to be shared, and they were sanctioned by organized medicine.
Over the last few decades, the views and the stigma aspect have shifted. Not only are there many additional advanced procedures being developed and better techniques furthered all the time, but there's also a wider range of patients and more acceptance and openness.
There's been a real shift and change in the past 15 years. What people who make up most of my practice are really just regular, normal people, very often very conservative people, who felt that initially that they wanted to age, quote, gracefully. In the modern world where we have so much control over so many things, aging gracefully does not have to mean aging passively. You can actually take control through technology, through access of how you look at any age and stage of your life. It's no longer a small percentage of the ultra-wealthy and quote, elite and actors and actresses. People come here from people who sweep houses to people who are billionaires, and everyone in between.
Furthermore, our idea of beauty has become quite diverse, with a more multifaceted recognition and appreciation of unique or ethnic facial features, and there's a more open forum to discuss cosmetic surgery in public than ever before.
Phyllis Diller, for example, came on the Johnny Carson show looking like $1 million, and she really looked very, very beautiful, really was a beautiful woman. And she had had surgery and talked openly about it. I think that was probably one of the earliest times that people would just say, hey, I had it, I'm proud of it, and that began to take effect.
This shift in viewpoint can be attributed to many things. First, the focus on health and fitness has led to a natural progression of wanting to look as good, as vigorous, and as youthful as you feel. And second, there are a lot more media outlets disseminating more information today, with more people speaking out about cosmetic surgical procedures. People today are not ashamed to admit that they had surgical work performed on their face and body to alter areas they were not completely satisfied with.
I became enamored with plastic and reconstructive surgery because it was very three-dimensional, it was very innovative and very artistic. And I saw breast reconstruction, which I found fascinating, where you would start off with nothing except a hole in a chest, and you would create what looked like a very reasonable breast. And that got me interested in reconstructive surgery.
They project a more confident image to the world, and they feel better, and their social relationships improve, and their working relationships improve. So that stigma is really fading significantly.
Now, there are very few people who really regard it in a secretive fashion. They might, and rightfully so, want to go away for a few days where the bruising is at its maximum, but generally people heal up really very, very quickly and can be out in society within weeks, even maybe 10 days in some instances.
The concept of physical beauty will always hold significant importance, as it has been programmed into our genes and brains as an eminent part of human existence. After all, had there not been a mutual attraction between males and females, none of us would have been here. One of the many things that attract humans towards each other is indeed physical beauty, but this fact does not justify our obsession with looks single-handedly, for appearance is only the first layer of attractiveness. It has been noticed that people who emphasize physical beauty may relate their appearance with the power to gain attention, which might suggest that a person changes his or her appearance in order to meet some current standards of what's attractive.
Some of the doctors that were the sort of the creators of modern cosmetic nasal surgery began doing work in the 1950s, following to some degree on the work that had begun in the 20s and 30s, but a big step was taken. For example, Dr. Howard Diamond of New York City, after World War II, in about 1946, began the study of and the practice of rhinoplasty, cosmetic surgery. And while the basics had been delivered to us by, of all things, an orthopedic surgeon in Berlin in the 1920s named Dr. Jacques Joseph, the fact was that it took Dr. Diamond and other surgeons to add perfections and efficiencies in the operation to make it predictable, to make it attractive to other people to have, and even affordable. Because as operating times are reduced, operations cost less. So really in the 50s is when the, quote, nose job really got going. And then, of course, in the 60s and 70s, many of us who began practicing that could stand on the shoulders of giants, such as Dr. Diamond in New York, Dr. Tardy in Chicago, Dr. Parks here in Beverly Hills. And hopefully we learned from them and could further advance the specialty.
There were other considerations that were social. For example, I recall someone saying that for Happy Rockefeller to announce that she had breast cancer was revolutionary. I mean, it was something people just didn't do. It was a secret before that time. Plastic surgery, cosmetic surgery was usually secretive. And even in the past, in the history of plastic surgery, cosmetic surgery was done secretively, sometimes in garages at nighttime by surgeons. that was a change in the process. Now it is in magazines, in television programs, part of television programs, and people are much more open about it. And it is a very, very honorable type of surgery to be done for the right reasons.
The cultural definition of what is attractive, continues to change and has evolved into this wonderful, I'd say, globalization of beauty standards. So people have been coming in more and more for procedures that actually gives them a more blended look. For example, with someone who is thin, light skin, maybe Irish descent, they would want to have fuller lips, okay? Or they want to have plumper cheeks that may be more consistent with another ethnicity. I think that in a flat world with globalization and internet and the industries of music and fashion, this combination of multicultural sense, I think people are really connecting and integrating so many of the things they find attractive about other people and other cultures and embracing that as something that they want for themselves, but still maintain the natural look that is still consistent with their own appearance.
Plastic and reconstructive surgeries in modern times are represented by a combination of different surgical skills, disciplines, and techniques. Many are considered reconstructive, seeking to reestablish normal and functional anatomy from a congenital or traumatic abnormality resulting from a disease process like cancer or a wound or infection. Practically speaking, the task of a reconstructive plastic surgeon would be to correct or regain the original form and function of the affected body part. The historic developments in operating microscopes led the way to procedures like reconstructive microvascular surgery and free tissue transfer, making it possible to perform progressively more accurate and complex reconstructions.
But within the last 50 years, microsurgery has made a huge impact on reconstructive surgery, and that's the use of the microscope, microscopic instrument, microscopic sutures to move parts to fill defects. For instance, in the lower extremity wound where there's a large defect where a normal skin graft or some other procedure is not going to save the leg.
Even as recently as 20 to 30 years ago, a facelift would be a 5-hour operation. There would be skin flaps, there would be blood loss, and the surgeon would spend a lot of time just cauterizing each blood vessel, and the downtime would be measured in weeks or months, not just days. In this day and age, with the ever-advancing technologies of anesthesia and more efficient instruments, people want and can expect minimal downtime. So, facelifts now are about laser facelifts with little incisions here and there, just 4 small incisions and using a laser underneath the skin to make the skin tight. So a laser facelift has scars that are usually acceptable, and there's still downtime, even if it's less than before. So it's very much driven by the market. Whether it's small reconstructive surgery, liposuction, or even breast augmentation, a patient wants to do it all on a Thursday and go back to work on Tuesday or Wednesday of the following week to a desk job. Today's liposuction patients will usually go back to work in 3 or 4 days. That's the world we live in. So it's been a joint evolution, both with the technological advances and the developing procedures of how surgeons do things. The future potential of plastic and cosmetic surgery is unlimited.
Surgeons worked closely with equipment companies and worked on their own to figure out how to use devices that were better for healing, better for moving bones and tissue around so that would be safe for everyone to have these operations. With the advent of better anesthesia, we were able to do these procedures and do them safely.
I have a laser for practically every application, but one of the most exciting lasers that we have is the Cool Lipo laser-assisted liposuction laser. With this liposuction tool, I can melt fat, and I can melt fat and tighten skin at the same time. By doing that, our patients are able to look better after a liposuction procedure, whether it's in the face or in their body, and get that extra little bit of tightening of the skin. We have lasers for hair reduction. We have lasers for improving sun damage, blood vessels. We have lasers and light technology for improving hair growth. So the technology has really given me so many more tools to then use my artistic vision of what I want to help a patient be able to achieve, and then have the right tools to be able to accomplish that. Now we have shoot. Now we have shoot.
We're on our 4th generation of laser lipolysis or laser body sculpting, and I think that at this point we are going to see a step up in terms of the ability to do even a more predictable liposuction using laser lipolysis. So that's one thing that I think is very much on the horizon, and I believe is working, at least in my experience.
Science never sleeps. In the biological science, in the physical sciences, every day brings advancement, and they always come home to help us in the world of medicine, generally, cosmetic surgery specifically. For example, there are laser devices. Laser is an invisible beam of light that has the power of a scalpel to cut, of a machine to seal blood vessels, all done through an invisible beam, with less swelling, less bruising. There's the great drug Botox, which paralyzes muscles that may cause too much frowning or too much grimacing. It's popular, it's practical, it's safe, and while it doesn't last forever, people appreciate the fact that they get 4 to 6 months of a wrinkle-free forehead if that's what they want. The list gets longer and longer, and today the young surgeons, I think, have a much bigger assortment, a bigger palette of colors, if you will, than we had when we started our career.
On a microscopic level, on a nanotube level, we'll be able to actually address the loss of collagen, the breakdown, the genetics of changes that can now be managed, hopefully in the future, through technology. So not only are we plumping with fillers, but maybe we'll be repairing the collagen through technology, through lasers or gene therapy. That there may be so many things that we do that would not require incisions, that would not require removing, but rather treatment that is correcting because what we're talking about really is genetics. The aging changes, and particularly in my specialty, I deal a lot with the fact that as one gets older, there are changes that occur. Those changes have a genetic basis. So if we get to the point where we can actually do gene therapy or do something that can help you maintain not only your appearance, but it'll also help with your health, because the same things that are breaking down collagen also contribute to arthritis and other degrading processes or loss of function. So gene therapy, ways with nanotechnology to recreate and rebuild collagen so that you can look very youthful without intervention like surgery.
I don't know if robotics are ever going to be a major factor in our work, because the sense of touch and the ability to stretch tissues is critical, and I don't know that that can be conveyed by the non-human hand. But I think there'll be other advances that help us.
Yeah, I hope a robot doesn't take my job, but I don't think that concept is really going to really catch hold anytime soon. I do think, for example, that a frontier within microvascular surgery could conceivably be to be able to put together smaller vessels, and that may require a machine of some kind that I right now don't understand, I don't think exists. That would be a real big step forward. But we're not really technologically dependent on a lot of machinery, that sort of thing.
But when it comes to cosmetic surgery, every face is different, and tissues are different. Some tissues are thick and aren't going to stretch as much. Others are thinner and subject to being damaged more easily. There's so many variables that judgment is called into play. And judgment is the single most important factor, in my opinion, in the exceptional cosmetic surgeon. The exceptional cosmetic surgeon has a sense of what looks right. He knows not to pull the skin too tight and give that almost Joker-like look, and he knows not to tighten too little such that there's not much evidence of improvement. That's common sense, what I call medical common sense.
When looking at how far the fields of plastic and cosmetic surgery have come, there is no question that the advances in technology have gone hand in hand with new procedures based on the patient's needs and the skills of the surgeon. Whether the patients of the future are a wounded soldier requiring massive reconstructive surgery, or a newborn baby with a cleft lip, or even a bodybuilder in search of becoming even more beautiful. In addition, many people see the recent increase in awareness and acceptance, which is due in part to the information we access through the internet, and that becoming educated and aware of all aspects of aesthetic procedures can better ensure a safe and satisfying surgical experience.
Every day in plastic surgery there's new developments, but a lot of the mainstay innovations take time. There's been new developments in plastic surgery, and some of the ones that are exciting for pediatric plastic surgery, the goal of the developments are to do the surgery with shorter recovery time and better healing, and these include things that have to do with minimally invasive surgery. So these are innovations in the last 10 years, the last 5 years that were unheard of a decade ago, but now are done and can be done for the benefit of the patient.
Years. I think that in the next 10 years, these minimally invasive procedures will continue. There's been great advances in tissue replacement, whether it's organ replacement such as heart transplants, liver transplants, and in the last few years there have been 2 or 3 successful hand transplants and one more recent face transplant that took place in France. I think in the next 50 years we will perfect the rejection phenomenon. So I think that will be really revolutionary in the next 20 to 50 years, the ability to transplant tissue. So someone who's had a hand amputated in an industrial accident theoretically will be able to have transplantation of a hand that will function and survive.
If you asked a person to project out 40 or 50 years, anything that I tell you by definition is going to be doubled or tripled, because what I can even envision is within my realm of consideration. So by definition it's going to be different. But here's what I'll tell you where we are heading. We will have stem cells for, whether it's for fat, for skin, for cartilage. So we will actually be able to create things. We will be able to do things in terms of face transplant. I still think you need the human mind. I still think you will need the human hand, okay? And you will need someone to care for the patient. You have to take care of the patient. It's not just a technique. It is part of a process.
The pursuit of beauty is often mistaken for that pursuit of vanity. But the fact is, beauty is biology. And in nature, beauty is about symmetry, about strength. And that appearance of attractiveness is actually, we're all biological creatures, and so what we want to do is increase our attractiveness, whether it's us or butterflies or peacocks. But attractiveness means more likelihood to be able to mate and to reproduce and to have your genes survive. And that is almost a mathematical approach to attractiveness. So yes, in cosmetic surgery, for me it's more intuitive. I look at a person and see what that balance looks like, and then if you were to step back and apply a mathematical equation to it, it would make sense.
So whether the future of plastic surgery will be driven by the needs of wounded soldiers in future wars, or the changing face of societies and their ever-evolving determination of what defines beauty, one thing is certain, that plastic and cosmetic surgery will be an ever-evolving field, but will always require the skill and talents of the surgeon's hands, with its future based in its roots laid down over 4,000 years ago.
throttling down now.